Hi, everyone. Welcome to the Healthy Enterprise Podcast. If you're back for more, thanks for joining me again. And if it's your first time, I hope you enjoyed today's episode. My guest for this episode is Dr. Merle Griff. She's the founder and CEO of SarahCare Senior Solutions. It's one of the top senior care providers in the U.S., and SarahCare offers adult day programs, memory care, and intergenerational activities that help seniors thrive and give family caregivers the support and break they definitely need. She's also the author of Solace in the Storm, Caring for Loved Ones in Every Generation. So please welcome Dr. Merle Griff. Welcome, Merle. Thank you for joining me today for this episode. I'm looking forward to having a conversation with you.
Oh, well, thank you for having me, Heath. I really appreciate it. It's great to meet you.
Yes, nice to meet you as well. And our listeners are going to want to meet you too. So this is a great opportunity for you to maybe just take a moment and introduce yourself and let listeners know about who you are and what you do.
Okay, well, I'm the CEO and founder of SarahCare Adult Day Health Centers. We take care of people during the day. We say 101 activities and home by dinner. So we like to think we keep families together and keep seniors in their community. We're staffed with nurses, so we can do a pretty high level of care while people are with us. But meanwhile, they get out of their house. They have fun. They have great food. They have friends. They just have a good time while their healthcare is being monitored. So it's much, much better for them. I'm a psychologist by training. Started out working with children. My area of specialty was 3 to 12-year-olds. I was a play therapist, and I've kind of worked my way through the lifespan and have been working with seniors now for a long time. I think the other important thing is I've been a family caregiver. I took care of my mother for many years in my own home after she had a very, very dense stroke. And I took care of my husband for many years who had a chronic illness and took care of him in my home. And one of my children had a very, very severe learning disability and is now doing great. And I think that changes your perspective. It's not that you're required to do it. I mean, there are many, many wonderful professionals who have not been family caregivers, but I think it gives you an insight into what's going on and how people feel in a much different way. I know that I changed some of the things that I was doing in SarahCare after taking care of my mother, especially.
It gives you a lot of insight when you're a caregiver, doesn't it? Like if you have never experienced the caregiving aspect, it's hard to imagine really what people need when they're in a state where they are in need of caregiving, whether it's a younger person with illness or if it's a senior at end of life care, whatever it is. Until you've actually had that caregiving experience, it's really hard to understand it. So um, that what inspired you to do this? Is after you were caring for your mother?
Actually, I had already opened up my first SarahCare Center. I made many changes, though, in the business. I made many changes in our processes and the way that we interact with families and the way we do intake. I developed new programs and new services based on my experience in taking care of her. Absolutely. Yeah.
And this is a large situation. We've got a lot of people moving into seniors in need of senior care, isn't it? So and I think we're not only halfway through sort of this huge movement of a retiring community, aren't we?
Yeah, well, it's interesting. There was a study done recently of something like 1,000 families, and it found that the average age of the primary family caregiver now for a senior actually was between 35 and 49.
Hmm.
And I think everyone always
Interesting.
thinks that the family caregiver for a senior is in their 60s or in
Yes.
their 50s, and that's not so. Uh,
Really.
yeah, it was a really interesting work.
That is very interesting. And are there numbers around how many people actually get to stay in their homes with their families? Because I mean, that's not a typical thing either. We've kind of, as a society, grown to put our seniors in homes or in places where they can be with other seniors, which is a community environment, but not a lot. What is the rate of people that actually have their seniors at home for caregiving?
It's actually increasing,
Yeah.
especially post COVID. People really reacted to not being able to get into the nursing home or get
Hmm.
into the assisted living during COVID. And they began to rethink through uh,
Mm.
what they were going to do and how they were going to manage. Plus, the other change was obviously with COVID, more people are working remotely, and so they're able to keep their parents, or sometimes it's the spouse. Parent people always think it's the parent. It's not always the parent. Sometimes it's
Right.
the spouse. Sometimes it's
Right.
a husband or a wife or a partner that they're caring for. And now that they're working remotely, they're able to manage the care a little better. Uh,
Hmm.
than they were able to do before. So COVID was a big factor and a big turning point in people choosing what we call home and community based services as
Yeah,
opposed to
it revealed a
residential.
lot of cracks, didn't it?
Hmm.
Particularly the one where you couldn't access your family members. I mean, that was probably the scariest one. And I know many stories were told about, actually, losing your parent during that time, and they were alone for that situation. So that's, yeah, scary for family members to see that and to know, okay, well, not only that, too, the resources that we have available to us, there's not as many places for people to go now. It's better if we can get as many people to stay at home as much as possible, isn't it?
It is, and we find we like people. I mean, we do some home care, and I'm not opposed to that. But if possible, I like people leaving their home and coming into our center. Uh,
Hmm.
because you know what happens if you've been hospitalized or you're sick and you're at home, you start to get disoriented, and your appearance tends to go downhill. Um,
Right.
so we find when people come out, suddenly they're aware of how they're dressing and how they're looking and bathing, and we can monitor their food and monitor their medication better. And they're with people, they're out, and they're engaged. It's much better for them. And so sometimes people will say, "Oh my gosh, I can't believe the change in my mom or my husband." I mean, it's unbelievable. Just getting out of the house and being with people again makes a big difference.
Yeah, amazing. And so I guess for listeners, it's probably good to explain that this is kind of like a day place, a place to go for the day, right?
Right.
And is it an everyday thing, or is it kind of a couple times a week, 3 times a week?
Well,
What's the
our centers are open 6 days a week. Some families come 2 days a week. Some families come 6 days a week. It depends on their work situation and their personal situation. But we have flexibility.
It's amazing. And so yeah, let's go over what kind of experiences can they have when they get there.
Well, we are taking care of people who, all the way from someone who's very frail, perhaps and depressed and lonely, to someone who has Parkinson's disease or a
Hmm.
stroke, or mid stage dementia. So the fact that we have nursing care is very important. But usually, what happens is they come in, they have coffee, they have exercise program. I love to watch the exercise program because my seniors are really doing it well. They're out there and they're just jumping up and raising their arms and doing their thing, and the staff is huffing and puffing. I'm like, look, guys, you gotta be as good as the seniors, all right? You really got to start exercising a little. Um,
It's funny.
and then they go into at SarahCare. We run 4 different activities at any given time, so it depends on what someone's interest is, what their functional ability is. Sometimes, we have men's groups because sometimes the men only want to be with the men and the women only want to be with the women.
Right.
We go out as much as possible. So we have adapted sports, we have adapted bowling, adapted fishing, adapted
Amazing.
golf. They go to the movies, they go out to eat at a restaurant. We want them out as much as we can get them out.
I mean, these things you're describing, it's exactly the reasons, these are the reasons why, people actually move into senior centers or care centers, or because it is in a community involvement. That's the
Mhm.
part that gives people a reason to get out of bed and go out. get out of their apartment, get out of their. So this is really nice. It's also maybe a bit of a respite for caregivers too, right? Because they can they bring them down and maybe they go off for the day and do something to regenerate and refresh themselves as they.
Because the biggest issue in taking care of someone is, and I don't care whether it's a child or whether it's a senior, it really doesn't matter, is your own health.
Mm-hmm.
And so taking care of someone who may be a challenge to take care of, even though you love to do it around the clock, is hard. And there's lots of research and statistics out there on the impact on the family caregiver's health. Heart disease, high blood pressure, sugar. So they really, really need that respite. They need to be able to do that.
Yes, it's a great thing for both parties to be able to experience this. And I was reading too something about locations that in some cases you've actually got them located near like a daycare program for
Mhm.
children. Tell me more about that?
We actually opened what was called the first shared intergenerational site in the country, which meant that the child daycare center and our SarahCare adult center were right across from each other. And so intergenerational really means building relationships. It's not that the kids come in Halloween in their little costume and they prance around,
Right,
which is very cute and that's very nice. But that's not doesn't really build a relationship. So
right.
we did everything from, and we do everything from rock-a-babies, which is the seniors, if they're able to, go in and rock the infants, the babies,
Wow.
and one-on-one time with them. I'll tell you something
Oh,
interesting.
that's amazing.
Oh yeah. Well, the most interesting thing about the program is who participates in that the most, the men or the women. So what would be your guess?
Well, I would probably normally say women, but you're probably going to say men.
That's right. Right. I set that up. Yeah,
Naturally, you would think it'd be the women would not want to be the mothering types, but is
right.
that right, eh?
The women are like, look, been there, done that. The men are like, I never got to do that. This is wonderful.
Oh,
Great.
wow.
Right.
Well,
And
they're at work, right? It's that generation where it's like that's what they had to do, and that's what the mothers did, and
right.
yeah, it makes sense.
It's all the way through high school students who have to do community service, all the way through college. So we've cross trained students in early education in dealing with seniors and students that are studying gerontology, doing intergenerational programs with kids.
Oh, I
Um,
think that's incredible to blend those communities together.
Yeah, well, I'll tell you a quick story. I ran into one of the kids who had younger kids who had been in the child daycare center and then had left because she was starting school. And I she was at one of my children's schools and I saw her and I said, Jamie, how are you doing in your new school? And she's like, oh, it's okay. And I said, oh, Jamie, I'm so sorry. What don't you like about your new school? And she said, there were no grandmas or grandpas in our
Oh,
new school.
that's adorable. Yeah. And I mean, maybe there's, I mean, I speak from my own experience. I kind of came at the end of my siblings. There's a 20-year gap between me and my oldest sibling, so I really never knew my grandparents. I never had grandparents, and so I feel like that I've missed that opportunity, And then because I was so much younger when my kids were born, my parents were already elderly and
Mhm.
and and were gone by the time my kids were 3. So they've had aunts and uncles, sure, but they have had that influence, but didn't have that grandparent influence. And I think a really cool thing to be part of in your family circle. The
Well,
elders, the people that
right.
and you learn to have that respect and that engagement with another generation.
Well, it's interesting. They studied years ago children, and they asked them how they perceived, how they saw, you know, seniors and grandparents. And many of the kids, especially because in the age of mobility, they're not with their grandparents very much,
Hmm.
describe them as old and scary and
Hmm.
smelly and, They then tested them and asked them the same questions after they had participated in a number of intergenerational programs, and everything changed.
Wow.
They were wonderful, and they were so patient, and they loved me, and it was great. So, intergenerational programs are very effective for both generations.
And is it that are you able to do that at all your facilities, or not just because of proximity, but
Yeah, we're able to do it at most of them. So
oh wow.
even if and it may not be the younger children, it may be the high school student who has to do
Right.
community service, or it may be a junior high, and we're doing a joint project with them, or doing a joint choir, or some agricultural gardening projects with them. It all depends, right, on the proximity.
Right. Right. Okay. Well, okay. Now take me back to when because you opened your first facility. In what year was it?
No, 1985.
85. I was going to say that's the year I graduated from high school. So I remember
Oh,
that. I
that
remember
was
that
so
date.
good.
So 1985. So that you opened your first one, and at what point in your in while you were there did you go, I want to turn this into a franchise, or was that always part of your business vision?
It was not anything I ever thought about. And actually, one of my lawyers, they have these kind of newsletters they send you. And one of the newsletters that I just happened to read by chance said, is your business franchisable? Not exactly good grammar, but that's what it said.
Right.
And I thought, wow, that's kind of interesting and kind of challenging. What was happening at that point is assisted livings were opening up like rapid. I mean, they were all over the place. And some of the care was very good, and a lot of the care was not very good, because for many people it was seen as a real estate deal,
Right.
not
Of
as
course.
senior
Yeah.
care, right? And so I kind of had this idea that maybe we could, I thought the next thing people were going to begin to look at was adult day healthcare. And that if we franchised it, we could bring people in who wanted to do it, but teach them how to do it well, at the highest standard of care. So it would be profitable. I mean, my centers are for profit and we are
Right.
profitable, but we still maintain extremely high standards of care. And so we began actively franchising many, many years later after I opened up the first two centers.
Hmm. Oh, you had two to begin with,
I had two to
and
be
then you started franchising after that. And now you're in like 13 states.
right.
And how many cities? How many locations?
Um, I should know that off the top of my head. We have about 30 centers and three new ones that are opening this year.
Wow, amazing. Amazing. Congratulations.
Thank
I
you.
mean, that must feel really great, and to be able to spread this philosophy and this idea into so many different communities around the country. So amazing.
Hmm.
You're
Thank
getting probably amazing feedback from people. I would imagine you had so many testimonials from caregivers and or from people who go to the centers and get the care, but also staff. I
you.
noticed
Mhm.
too.
Right.
So a lot of people will ask, how do you manage the staffing? I mean, that's resources seem to be always spread thin and tapped,
Um,
and how do you deal with that
Staffing is a
challenge?
little easier. I mean, in my past, I've owned nursing homes and assisted independent living and home care. I can tell you that staffing the adult day health center is actually a little easier.
Right.
The reason for that is our ads read no weekends, no evenings, no holidays. It's a dream job. So
Right.
if a nursing assistant has been working in a nursing home, she's pretty overwhelmed. They're working one staff member to every 15. We're working on one staff member to every four people. It's
Oh wow,
a
that's
heck of a
very
lot.
different.
Plus, they get to do activities with them. They're not only just doing personal care. So they get to do lots of fun things with them, including going out on the outings with them. And they don't have to worry about being away from their family on the weekends, or if they want to see their kids' baseball game at 6 o'clock at night, they're done and they can go to
Right.
the baseball game. Um, the other big thing is, and the staff across the country tell me this. It's much, much different for them because they actually form relationships with families. And the families are always telling them how much they appreciate them and how wonderful they are. They, they bake food for them, they bring them all kinds of things. So they feel important, and they are important. And they feel as though they're really having an impact on people, and they really are. So it's a little easier for us.
Yeah, well, they're contributing to that building and reinforcement of community, right?
Mhm.
Yeah, which is sometimes gets, when you particularly when you talk about an elderly person, sometimes they have less and less friends and family members around, and that loneliness factor can really have a major impact. I mean, your background is in psychology, so probably as well as anybody that depression sometimes is rooted in loneliness, right?
Yeah, no, it absolutely is. And people also get disoriented when they're too isolated, and they spend
Mm,
too much time alone.
is that right?
Mhm.
What triggers that? What's that caused by?
They're not forced to deal with reality, and they're not talking to people. They're not seeing people. They watch it. They tend to watch a lot of television, and so they lose touch with what day it is, what year is it, what season. I mean, they just they become very depressed and very isolated, and they do begin to come often disoriented.
Well, I guess they're not exercising that part of their brain, I suppose, where you're engaging with people, having conversation, connecting, asking questions, and yeah, so I can see that. Yeah.
Right. And for instance, in our centers, we do a program called Brain Savers, which is a cognitive physical fitness program developed by a neurologist, well researched out of Arizona. And so you have experiences that you're not going to have if all you're doing is sitting at home.
Right. Right. That makes sense. Is there a limit to how much care a person needs for your centers? Like, if is there a point where it's like you can't accept them because they need too much care or they need too much attention during their visit?
Yeah, I mean, we pride ourselves at doing a pretty high level of care. We have people in feeding tubes and colostomy bags to be
Right.
brittle diabetics. But if someone is on an IV, we can't
Right.
accept IVs. There are not a lot of behavioral challenges that we can't accept. We really try to work with people, but sometimes there are some. And I know that when there's a behavioral problem like physical aggression, that's also happening in the house.
Mm-hmm.
And then it becomes a safety issue for
Mm-hmm.
my caregiver as well as for us.
Right. Absolutely. Yeah. So then if you have sort of groups of people who are not as mobile, they don't necessarily go on all the field trips. You kind of have different levels of activities for different groups of people, and people are, oh, this group's going to go out on a field trip and this group is going to hang back here and play
Well,
cards or something, or is that kind of
and
how it
a lot
works?
of it really has to do with interest,
Mm-hmm.
because we have vans with wheelchair lifts.
Oh, right.
Yeah, so we just wheel them right on
Oh, wow.
with a wheelchair lift, and up they go. And yeah, I mean, we have to make sure that wherever we're going is handicapped accessible.
Yeah, of
Uh,
course. Yeah, makes sense.
but other than that, yeah, we just you got to move.
So amazing. That's so great. Um, all right. So tell me about your transition, as a founder and as a CEO, that you have gone from, one facility to two facilities, and now you have this franchise business. How have you evolved as a professional in that regard, where you are now leading this this force? How have you transitioned as a business leader yourself?
It's different. It's hard because when you own the centers, that staff is your staff. All right.
Hmm.
So if things aren't moving quite the way you want them to, or as quickly as you want them to, especially in opening, you can come in and take control of that and direct it as you want it to go. with franchisees, and I mean, I've been very blessed and very lucky. I have great franchisees, but you can't have that direct approach.
Right.
You have to work through the franchisee. So if the franchisee has signed and now they're looking for space, and they don't look for space for a month because, oh, I'm a little busy and I have this family event coming up, and I thought,
Right.
you can't say to them, look, you got to get on this,
Get to work.
you got to work. So you have to learn to be a little calmer, a little more patient. It's a different franchising is a different approach. Um,
Right.
it's not a direct approach, and you have to learn to operate. Your leadership style has to be modified.
Yeah.
Absolutely.
I'm sure some people listening are their control flags are all popping up like, I can't let go of control long enough for that. How do I do that? Is that what you're kind of talking about?
Yeah, I mean
Yeah.
you have to learn to keep your mouth shut at times. You know, you know it's not like you're staff member, who you can say, I mean, like, we rolled out what we call restorative nursing program, and I had two franchisees who hadn't implemented it yet, and I said, why not? I don't understand this. You can use existing staff, it makes people better, and you can bill for it. I mean, what are you waiting for? They're like, oh, well, I don't know. It's new and da da da. So we worked with them and we got the new programs in, but it was at a much different rate of implementation than
Right.
you
What
own the
was that program? What was that about?
restorative
Restorative.
nursing. Well, what
Yeah.
happens when you're in physical or occupational therapy, there's something called Medicare Flins that pays for that physical or occupational therapy.
Mm-hmm.
If you're not making enough progress quickly enough, according to the Medicare Flins, the physical and occupational therapists have to discharge you. They have
Oh,
no
really?
choice, all right? But if you can continue to make progress, then our restorative nurses will begin working with you.
Oh,
So
I
you can
see.
continue to make progress at a slower rate that doesn't impact us. So it's really an outstanding program. We've seen people make a lot of progress with us with restorative nursing.
Hmm. Very interesting. Yeah.
Mhm.
Um, so that the franchise model, you've rolled this out, and now you're sort of adopting this new philosophy in business. You've got franchisees in all these different centers. Tell me about, like, if at what point, what was the deciding factor for you for doing the franchise in the first place? I mean, you could have just opened up individual centers and
Right, which honestly my husband wanted me to do.
right.
He was like, "Why are you doing this? Just open up more centers." Or, I don't understand what you're doing. And I said, I don't know. I know that people are going to do this. I know this is a business that people are going to go into, and I'm really convinced that we can teach them to do it really well, at high standards of care, and not have it be like the assisted living business, as it turns out. Um,
Mm-hmm.
and that was really the motivation for it. Now, if I had realized going into it how involved it was, and how much it cost, um, I'm not sure I wouldn't have opened up more company owned centers. But in retrospect, I'm glad I did. I have great franchisees, they have great centers. And they tell me, I mean, we get a lot of great feedback from the franchisees that it's changed their life. I mean, I walked into a center one day, and my franchisee, who was not an owner operator, he was an engineer, was serving lunch to the participants. And I'm like, "No, what are you doing? You're serving lunch." He's like, I just love this. I can't tell you how much I just love this.
That's
He
cool.
said, I feel so much better being here than I do back in my office.
Well, that's something you wouldn't get, having a an independently owned, or not, as opposed to having owned all your locations and just having managers in each location. You wouldn't have that degree of self interest or self pride or passion behind it than as if you have somebody who's actually part owner, because that's really what they've become, right?
Right. Oh, no, absolutely. And our franchisees are on a call once a month. We do an educational part at the beginning of the call, but then they talk to one another, and they'll say, "I'm having this problem. How do you solve it?" And people respond. So there is a feeling of closeness among them, that they support each other and they help each other, and feel really good about what they're doing and about their work, which is key, as you know.
Yeah. Yeah, like a business group where you just kind of bring them all together and they share their ups and downs and victories and everything else. Oh, very interesting. Yeah, that's a great way to understand that.
I have one of my franchisees, and as the lingo goes, is a real techie. And a while ago, he was on the owner's call and they were talking about something. And he's like, "Look, you have to use ChatGPT." And they were like, "What? What is that?" And he's like, "Oh, no, no, I'll teach you guys how to do this. This is great. All right. This is the newest thing. And you really got to learn how to do this. All right." And they were like, "Lewis, what do you use this for?" And he said, and he talked about all the business uses that he had. You have to be
Right.
careful with ChatGPT because it's not what we call HIPAA compliant. So you can't put any medical information or name it.
No.
But he's like, "Oh, I use it for this and I use it for that." And he said, on a personal basis, I also use it to write love letters to my wife.
I've not heard that yet. That's funny. I might have to borrow that. That's great.
Yeah.
Hey, that's a good segue too. You brought up AI. Probably you're probably not using a lot of AI other than ChatGPT, but what other kind of innovation or technology have you sort of infused into the company?
I'll tell you, we end up being, not so much a distribution channel, but a clinical research site,
Hmm.
for new technology that's being developed. I mean, part of the problem is the foundations or the VC or whoever it is funding and technology, but then they have to go out and they have to test it.
Right. They need data. They need research. Yeah.
And what they found was they really couldn't get enough seniors who were willing to participate, and try out a new technology.
Oh, amazing. Yeah.
We have a lot of relationships where we do that. We give our families a small reduction in their daily rate, in exchange for working with us and giving us some data on how the technology works. And sometimes the developers love what our people have to say, and sometimes they're not so happy with what they have to say.
That's called a clinical trial,
That's
right?
right.
You can take that information and do whatever you want with it,
That's
but that's
right.
the information. Yeah,
That's right.
that's the way it goes.
Um,
That's a great thing. I would never thought of that actually. It's fascinating that that could be used because and you got such a wide variety of people from various socioeconomic groups that
mhm.
that kind of diversity in those kind of clinical trials would be very helpful, I would think. Yeah.
Oh yeah, it's very helpful.
Yeah.
I mean, we used to say 65 and above, then we went to 60 and above. Now we're at 50 and above. I mean, we're seeing a lot of early dementia, early stroke,
Hmm.
early Parkinson's disease. So
Mm-hmm.
we have a wide range, in terms of ages, in terms of the ethnicities, in terms of gender. So we're really a great clinical research site, for a lot of the emerging technology.
Hmm. Very cool. Very interesting. All right. So now you've just opened 3 locations, you said. Just your newest 3 locations.
Mhm.
Um, what is growth look like for SarahCare now? How big you want to get?
We'd like to probably get up to 100 units.
Yeah.
We see that we're getting rapid growth all of a sudden. People are coming out of COVID. They realize people want to stay at home. Um, Home care can be challenging,
Mm-hmm.
and so people are really beginning to look at adult day health, very seriously. So we think we're going to see some rapid growth. And
Yeah, I
that's
mean, at, in-home care does not give you that community, that engagement with humans that you are offering. I mean, that just is such a big part of it.
right. And we've developed some new programs. We have a new program called Studio 55. It's for those people who are living, especially in active over 55 communities, where one spouse is leaving to go play pickleball and cards and whatever, and the other spouse who cognitively is just fine. It may have been a physician or a lawyer or an engineer or whatever they were doing, but they're a full risk, and they have
Mm,
problems, and they may need some assistance with their personal care. There's some reason why they can't be as mobile and they can't be as active with their spouse.
right.
So they come up to the community room to our program called Studio 55. It's designed for 10 to 12 people. We do whatever activities they would like, we design around them. They get out, they're with people, they're active, they're much, much happier than sitting in their house on a one on one basis. I mean, I've walked in and I had a group of guys that were working, they were watching videos on heart surgery. I'm like, what are you guys doing? They're like, we think this is great. Like, okay,
All right.
as long as you're happy, it's fine.
Whatever floats your boat.
That's right.
For a minute, I thought it was Studio 55 was going to be a level up of like some sort of Studio 54 disco dance get together.
Well, we had to find another name for it, because the active over 55 communities were concerned about their branding in terms of their marketing. So they didn't want adult day health. So we had to find a
Right.
name. So I'm from Philly originally. I knew Studio 55. So I'm like, hey, let's just call it Studio 55.
I think it works. You think it works? Yeah.
Yeah.
Okay, so so you're gonna grow, and how do you find new franchisees? Like, what is your method of attracting them and showing them how this could be a viable and worthwhile venture for someone?
Well, most franchisees come through what we call franchise portals. They're on sites, internet sites, where they're looking for a franchise, or they may just Google adult daycare franchise,
Mm,
or senior franchise. And so they come to us through that. We have a 5 step process we put them through. And the last step being what we call a meet the team day, where we interview them, the whole team, the whole upper management team, and they interview us. We show them everything that we're going to be doing for them as a franchisee, including all their policies and procedures for their specific state, all their job descriptions. I mean, they have 8 days of operations training where they're actually in our centers. It's a pretty intensive, plus ongoing support that they get.
do you from your end, do you kind of look at different locations of where you're not at now and look at, oh, okay, what's going to be the most viable location that we set up, and then you sort of target that area and go, hey, we want to open a center here, we're looking for franchisees? Or do you ever approach it that way?
No, usually what happens, they're coming to us and they're saying, here's the area where we'd like to be. We then run the demographics. We know we need a certain number of seniors within a 20-minute driving radius at a certain median income. Uh,
Mm-hmm.
the demographics don't support that area. We're going to tell them,
Right.
this is not good. We need, you can move here, you can move there, but this area is not going to work for you. Right now, we're only trying to franchise in those states where we already have centers, because we're trying to build the brand.
Mm-hmm. Right. Are there a lot of regulations for you when you enter a new state? So every time you're already in an existing state, to open a new one within that state's probably easier than venturing into a brand new state.
Right. I mean, one of the things about adult day health is it is not consistent from state to state. And so you really need to know how to enter a new state, how to become familiar with those regulations,
Mm.
how to write those policies and procedures according to what the state wants. We're pretty good at that. We've been doing this a long time, and we've been crossing state lines for a long time. So it's something that comes pretty naturally to us. But it has been in the past a problem with the technology.
Mm.
So, my former chief operating officer wanted to go with a software, and I said to him, "This is not going to work. They've never worked outside the state of New Jersey. They are
Mm.
not going to know how to cross state lines. It's going to be a problem with billing, is what it's going to." And he's like, "I don't." Yeah, that's exactly what happened. The billing system is, it's not like nursing homes where it's the same Fed forms in every state. It's
Right.
different in every state, and the technology just couldn't keep up with it. So
Right.
now we're in a great software company.
And so then you support, and that's a huge support to provide that, policy, procedures, infrastructure to the business,
Mhm.
and branding and marketing as well, I would imagine.
Right, right. So we have a something called the Hub. It's our intranet site. So all the marketing collateral is on there, all the PowerPoints, all the staff training is on there.
Wow. Yeah.
Everything is there, so the owner can access it 24/7. So if they're working and they still want to access some things at 2 o'clock in the morning, it's there for them. They can do it.
Amazing.
hmm
Yeah, that's amazing. Wow, very cool. It sounds like an amazing opportunity for someone. And do you find people that have already come from that background, who are interested in franchise, in a
It's,
franchise,
it's,
or
it's a combination. I mean, we do
yeah?
have some franchisees who are nurses and social workers and physical therapists. A lot of physical therapists will
Oh, really?
uh-huh. But we do have financial people,
Just
and
see a good business opportunity.
they
Right.
recognize the senior market. They want to be able to get into the senior market. Um, Many of them, though, do come to us with a personal story. It's a father they've been taking care of,
Right.
or a mother, or a grandparent.
Mm.
But they come from a business background. But we want them, I- that having that business background is very important. I mean, when we have our annual conferences, I always bring in a speaker from NFIB, which is the National Federation of Independent Businesses, to talk to the franchisees about the new regulations, especially in the area of human resources, and new laws that are pending and new things that have passed. And I tell them, you're not only running, a clinical site, an adult day center, but you're also running a small business, and you can't forget about that. That's very important. And
Very,
you
very
you have
much.
to stay focused
Hmm.
on business as well.
Well, I think that's really good advice. Actually, I think that's a great point. I'd like to know, if is there any other advice you have for somebody. So, if they were to venture into this, what advice would you give them? What kind of support, as far as um, you know, uh, taking on an organization like this or a company like this?
They really have to decide ahead of time what their role is going to be, and think that through. Are they going to leave their job and they're going to come in as an owner operator, or are they going to stay in their job and hire someone? How are they going to manage that, and how are they going to support that? For people who don't have a business background, we put them through a financial 101. You'd be
Wow.
amazed how people go into a business and they don't know how to read a profit and loss statement,
Right.
and they don't even look at it. And even when you give it to them, they're like, "Oh, I don't want to see it." No, no, no. You have to
It's
look
true. It's a weak link. It
at
absolutely is.
it.
Yeah.
And they don't know how to read a balance sheet. So
Right.
got to put them, and we give them a lot of tools. We have what we call a census workbook, which we give them, and it's all the formulas are locked. It's on Excel, and they have to learn how to use these tools to run their business, and they have to be willing to commit to that, um, and really stay according to a budget and really use their financial tools to
Hmm.
help them in their business. You
Good
would.
advice.
It's amazing how much hesitancy there is in that among franchisees.
Is that
And
right, eh?
I have friends who are franchisors with other types of businesses, food and other type, and they all say the same thing. They have about a large percentage, 80% of their franchisees who are very hesitant about running the business as a business.
Hmm. Really? Isn't that interesting?
Hmm.
Very interesting. And even though you have, I mean, this kind of support, I mean, when you open a business, anyone who knows who's opened their own business, you know, you get support, but you don't get this kind of support. You don't get someone telling you, oh, here, you got to learn how to do this, you got to learn how to do that. It's incredible, actually, that you can provide that kind of support to them. And because, I mean, if they succeed, you succeed. You know, it's kind of
Right,
like it's a partnership in growth, right?
right. No,
Yeah.
absolutely it is.
Amazing.
Yeah.
Amazing. Man, we could go longer, but I want to talk about your book, Solace in the Storm, because that's something that's new, that's recent, right?
Hmm.
And I want
Yes.
to hear about that because that's an important part of what's going on for you right now.
Hmm. It has to do with family caregiving all the way from infants through the lifespan to seniors. And the reason I did that is because many of us are taking care of multiple generations. We have children, we have grandchildren, we have children who are older, who are adults, who are young adults. We have grandparents, we have spouses, we have parents. So, in this way, you can go to the chapter or chapters that you need and
Right.
just read those. It's designed, it's based on my own family caregiving experience where people mean well, but they say things to you like, oh, you have to take care of yourself. And every family caregiver is thinking to themselves, are you kidding me? Come on now. Do you have any idea what my life is
I
like?
have no
Please don't
time
sit
for
there,
that.
right, and tell me I have to take care of myself. I don't have an hour to sit and meditate here. I mean, that's
That's it.
impossible.
That's right.
Okay, can't do it. All right. So the book is filled with things you can do in 5, 10, 15 minutes throughout the day to help yourself and to refuel and to get that little bit of respite that you need in order to continue caregiving. Um, and there are some other, kinds of tips in there about like, what do you do when your child who's an adult now moves back home again? How do you manage that? How do
That's
you
very
manage, Aunt Jane, who is always telling you how you're mismanaging your 2-year old and how you have to do it differently.
unsolicited advice. Is that what you mean?
Yeah, that's what I'm talking about.
Yes.
And that's really what the book is about, and how to deal with professionals, especially when you're dealing with a senior. And what do you do about a resistant senior who you want to have a discussion with them about finances or where they're living or how they're living or whatever. And, they're very, very resistant. How do you manage that? How do you communicate in a way? How do you handle your siblings who don't live in town and when they show up in town have nothing to say but, about you should be doing this and you should be doing that when you're the primary family caregiver? How do you manage that situation without having an explosion? So,
Such important topics, and there's so many variations of how of what those experiences are like for people. So
mhm.
I'm sure that's a very helpful publication for people to get their hands on. And if they want to get a copy of that, where do they find it?
The easiest way is obviously Amazon.
Amazon.
Yeah,
Great.
yeah,
Solace in the Storm.
yeah,
Amazing. I could
yeah.
have used that book. I've done I've caregiven for two parents who are all gone, my wife's mother who's gone. Our kids are grown up, they've left the house. Actually, I think one is on his way back. And then my wife just went through a stem cell transplant the last 2 years, so
Oh
I was a primary caregiver. So we're
wow,
just coming out of that storm. um,
wow,
Maybe I still need your book. I think I need to get a copy.
wow.
uh, Merle, I've really enjoyed our conversation today. Is there anything that we didn't cover that you want to make sure you get out?
No, I really thank you. We've covered a lot, so thank you so
We
much.
did cover a lot. Yeah,
Yes.
we're already out of time. We could have gone on for another hour, I think. So maybe we'll do it again. So thank you so much for coming.
Thank you.
If people want to reach out, maybe tell everybody what the website is for SarahCare.
It's www.SarahCare. It's SarahCare. We also we're on Facebook for SarahCare, and also Dr. Merle Griff on Facebook and Instagram. And
And
Solace
LinkedIn.
in the Storm. Yeah.
And Solace in the Storm. That's
Yeah.
right. You know what I didn't ask you? Where did the name come from, SarahCare?
Oh, it's always the disappointment. People think that I named it after a family member, and they're waiting for the story about the treasured family member. But
Right.
actually, it's an acronym. Um,
Oh,
it stands for Senior Adult Recreation and Health.
that's cool too. That's very cool. I like that. I'm glad I asked. So yeah, I was expecting a story too, but I don't know. That's good too. I like that. I would never even thought of an acronym, but that's awesome.
Yeah.
Okay. All
Yeah.
right. We can
Okay.
end with that. Thank you, Merle, so much for your time today.
Thank
And
you.
it's been great to meet you.
It's been great to meet you. Thank you.
Okay, big thanks to Dr. Merle Griff for joining me today. What an insightful episode, learning about how important community and engagement is for seniors or anybody in need of care. I think it's great that more people are being able to stay home, age at home, be cared for at home. But I think it's very important, as Merle pointed out, that they need to get out. They need to have a reason to get out of the house, to do their hair, get dressed, go have an experience and connect and engage with others. Particularly in the intergenerational program, I think with younger generations mixing with older generations in more meaningful ways, very, very important connections. We talked about caregiving and how important it is for caregivers to rest and refresh. And this is a great opportunity for caregivers to, take their loved ones to the centers where they can have an engaging day, be looked for, cared for. Well, thank you for tuning in today. Hope you enjoyed this episode. If you did, please subscribe. And if you feel like someone could learn and benefit from it, then please share the link with them as well. And until next time, take care and stay healthy.